Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease, and that discussion is based upon the questions that you write to me. So I'm very interested in seeing what you have in store for me tonight. For those of you that are new here, welcome. I see a number of new names on my message board. The way that you can participate is there's two different ways. Number one, you can write a question to me. And the way you do that is there's a chat box at the bottom right-hand side of the screen. You can write your question there. The only thing I ask is as you write it, don't hit the enter key until the whole question is written. Each time you hit the enter key, it sends a different question to me, and it gets to be hard to follow from my side if you try to break that into multiple parts. For those of you that are coming back here again, welcome back again too. I see again a number of familiar names on my message board, and I'm glad to see that you keep getting some help here. I am creating a recording of tonight's webinar tomorrow morning, hopefully before 9 to 9:30 a.m. Pacific Standard Time, Seattle time here. You'll get an email from me notifying you that the video has been processed. There'll be a summary of what we talked about in that email. You can also use that email to sign up for next week's webinar. So we're doing 3 May webinars, and at this point they're scheduled back to back. Although I may need to move that third one. But anyhow, next week will be a week from today. And so you can go ahead and sign up for that too. When you get those emails tomorrow morning, or that email tomorrow morning, go ahead and share it with other people you think might get some benefit from what we talk about or from signing up for future webinars too. Okay? All right. So I think that pretty much covers all the background information here. Oh, one other thing. During the webinar, I will wind up reading the questions out loud. For those of you that are participating in the live version, though, you can actually get to read them at the bottom of your screen. Okay? So feel free to follow along if you're in the live version. Okay? So let's go ahead and take a question here. Hello, Dave. Hello, Dr. Ross. Once you get rid of yeast overgrowth, can you get it again? Is the only way you get it again is by going back on antibiotics, or are there other ways of getting it? Thanks. So clearing yeast overgrowth does not mean you won't get it again. All right. And so there's two. So first of all, whenever you've been on antibiotics for any period of time, you disrupt the good bacteria that live in the intestines. And if you disrupt the good bacteria, that makes it easier for yeast that live there also to take over territory. So good bacteria that get disrupted do a good job of trying to fight back or war with the yeast to keep them from taking a foothold. But once you've been on antibiotics, that changes the nature of the gut microbiome. And one of the consequences of that is that over time, you could have periods where you get into yeast. As a point, to make that point even clearer, if I've treated somebody with Lyme disease and I got them all well, and often, and sometimes, not often, but sometimes some of those people will come back and see me about a year, 2 years later, and they'll have symptoms that look just like their Lyme came back. But when I dig in a little bit further, I find out that it's too many yeast that started growing in their intestines. And that's because they, again, from having been on antibiotics, that can lead to an easier possibility of yeast developing years down the road. So, yeah, it can happen even if you're not on antibiotics just because it's a setup. One thing I try to do with my patients when I'm done treating them with antibiotics is I like to leave them on probiotics for at least 6 months beyond when I treated them, sometimes even up to a year. And I'm doing that to try to repopulate the intestines with good bacteria to fight the yeast back. Okay, all right. And then, so yes, getting back on antibiotics could lead to yeast, but also just because you disrupted the good microbiome by being on antibiotics as part of Lyme treatment can lead it to happen even without going back on antibiotics, okay? Other things that can lead to yeast overgrowth in the intestines would be COVID. COVID disrupts the good gut microbiome. It actually alters the bacteria load that is in the intestines and can make it easier to get yeast. Being on steroids is one of those things that can lead more easily to having yeast as well too. And then finally, having been on antibiotics for any period of time can do that even if you're not on them right now. Okay? All right. Thanks for that question, Dave. Good luck to you. Hello, Angela. Let's see. Thank you for caring about those who struggle with this debilitating disease. You're welcome. After 25 years and 35 plus doctors, I was diagnosed in fall of 2020 with Lyme disease and MAST Cell Activation syndrome. Each year since, my infectious disease MD has given me 12 to 14 weeks daily IV Rocephin through a PICC line. I'm currently in week 9 of 12. She's only been able to give me 1 gram per day this round, as 2 gram caused too many adverse reactions this time. After I finish the IVs, the short reprieve of some lower but still present symptoms lasts no more than 6 months. Then I am back where I started. I have pain in my joints and muscles, paresthesias in my lower legs at times all over, tinnitus, anxiety, dizziness, fatigue, buzzing, sensation in my body, sensitivities to light, sound, smells, and reactions to many medications and herbs. I gave my doctor your book and told her I need her help. Though she has studied Lyme, she read it and was very impressed. This time, after the IV, since Johns Hopkins studied herbals, and with Angela, I know there's a second part here. I'm trying to find it. I found it. Let's see. And what herbal should I start with and how much? Tinctures are best, have mast cell activation syndrome. Okay. So, Angela, in terms of the herbal antibiotics that I like to use to treat the Lyme infection, I usually have people start 2 tinctures and then some capsules of something called liposomal cinnamon clove oregano. So the herbal tinctures I have people use are cat's claw and another one called otobobark. And I started using both of those tinctures together based on studies that were published by a researcher named Eva Shoppe, maybe about 10, 15 years ago now, in the Townsend letter, where she showed that they did a great job of killing both spirochete and cyst Lyme, but also breaking down what is known as biofilm or slime layer that can grow and cover the germs. All right. And what I have people start at usually is 5 to 10 drops 2 times a day, and increase by 1 drop per dose per day until you reach 30 drops twice a day. I also advise that if you get into any worsening of your symptoms, which could indicate a Herxheimer reaction, that you stop increasing until that Herx passes, okay? Now, the other thing that I add in over the last few years is to have people take with that capsules of something called liposomal cinnamon clove oregano oil. And the reason I have people do that is we now recognize that Lyme has different growth states. There's growing Lyme, and there's what is known as hibernating or persister Lyme. And I'm trying to do things to treat the persisters. There are studies that got published out of Johns Hopkins University a number of years, over the last 4 or 5 years now, that show that the oils of cinnamon, clove, and oregano are effective against treating growing and hibernating forms of the Lyme germ. They also have the ability to break down biofilm, slime layers that cover the germs as well too. All right. So I'm the cinnamon, clove, oregano I include to go after persisters, although it can help with growing forms. And I like using the cat's claw and the atoba because they're effective against growing forms of spirochetes and cysts. All right. And so let me talk terminology here because this makes it all get confusing. So the Lyme germ has 3 different appearances. And in addition, the Lyme germ has different growth states. So the appearances are a spirochete. That's the thing that looks like a corkscrew whenever you've seen it, pictures of Lyme. It also has a microscopic form called cyst, and there's a third form called an L form, which also lives inside of cells, and so therefore we call it the intracellular form. Okay, all right. Now, the forms can be growing or they can be hibernating. All right. An interesting point is the cat's claw that I just mentioned too has got some evidence published out of Johns Hopkins University a couple of years ago now that shows it might treat some of the persisters too. But I like using all 3 of those in combination. Okay. Now, what I cannot tell from your symptoms, but I sometimes wonder about when I see people that have a lot of neurologic symptoms, is there also could be the possibility that you have something called Bartonella. And that's something you ought to review with your infectious disease doctor to see if she thinks, based on your symptoms, if you have Bartonella or not. And if you do, you may want to take a look at some treatments. I recommend using something called Hutania and Sida Akuta. And I'll show you where you can get information on that here in just a second, okay? All right, so anyhow, those are some thoughts that you may want to take a look at, okay? All right, so let me just do a quick screen share here, everyone. And Angela, I'm glad your doctor, oops, I guess I didn't get this set up. Hold on a minute. I'm glad that your physician, your infectious disease doctor, found that my information helpful. That's good to hear. I tried to put a lot into that book, which is based upon my online writings as well, too. And I'm just trying to pull up that website, so bear with me here just a minute. All right, let me try to do that screen share again. Okay, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. Take a look at my Lyme treatment protocol called the Ross Lyme Support Protocol, in which I describe the key things you should build in a treatment. Like, you should try to get 7 to 9 hours of sleep. You should try to be on a diet that is a low inflammatory diet. You should work on steps to control inflammation chemicals called cytokines. And I describe in here the steps you might want to do that. But all the way down here, I get into what to use for the Lyme infection. That's step 11. And in here, one of my options is to do a supplement-only antibiotic protocol. That's the Otoba, cat's claw, and the cinnamon clove oregano. And in section 12, I talk about what to use if you happen to have Bartonella using an herbal-only protocol. And that's that protocol I'm circling up here. Okay. Now, to help you figure out if you might have Bartonella, there's laboratory testing you can do, but also I'd like to rely on what the symptoms tell me. All right. So take a look at this how to diagnose section and see this article on how to diagnose Bartonella. And in here, you're going to see that in here, I talk about what the symptoms are of what would look like Bartonella. All right. So take a look in this article. If you have enough of the symptoms to suggest Bartonella, then you may want to see if your infectious disease doctor would help you treat Bartonella as well, too. Okay? All right. Good luck to you, Angela. Thanks for that question tonight. Hello, Jackie. Let's see. Hi, Dr. Ross. I'm following the weed seed feed protocol for chronic intestinal yeast overgrowth. I now think I've had mast cell activation syndrome for years. Could my symptoms be mast cell activation related? For example, fatigue, chronic abdominal bloating, and tinnitus, itchy skin, new allergy response to strong fruit, sneezing and low pollen seasons, neuropathy. Also, pounds of water retention and subsequent release days after. Have you seen chronic cases take more than a month to stabilize with Histoquel? Are there any other treatments like ketoprofen that do not cause weight gain? Any other suggestions to control chronic mast cell activation syndrome? Thank you. All right. All right. So, everyone, so let me describe what mast cell activation is here for a second, and then talk about this weed, seed, and feed approach that you mentioned here too. So mast cell activation syndrome is a condition where your mast cells get overstimulated and overturned on. So mast cells are your allergy cell. They're what make histamines and release the histamines whenever you're exposed to something you're allergic to. In addition to making histamines, they manufacture cytokines too. And we now know that it isn't just things that we're allergic to that turn them on. Other infections and toxins can turn them on too. So Lyme can turn them on. Bartonella babesia can turn them on. Too many yeast living in your intestines can be a really big trigger. Other things that can trigger them would be mold toxicity and extreme stress. Anxiety is one of the bigger stressors that will cause activation of your mast cells, all right? So my approach to treating mast cell activation is to, number one, take steps to lower your stress. If that means removing those things in your life or from your environment that give you stress, like taking a different job if you're working in a high stress state and it's the job that keeps adding to your stress, or if it means going into counseling with your spouse so that you can deal with issues that keep giving you stress, or if it's meditation, whatever it's going to take to lower stress in your life, that's step number one of how you deal with mast cell activation, all right? Number two, identify what infections might be triggering your mast cells to get activated. And one of the bigger infections that can trigger mast cell activation actually is too many yeast in your intestine. So I'm glad to see you're taking steps to address that as well too, okay? Number three, if you have mold toxicity, deal with that. And number four, you want to try to remove things that you know you're reacting to. So if it happens to be certain foods, if it is pollens in your environment, whatever, the cat with the dander around you, whatever it is that's triggering allergic reactions, try to eliminate and remove those as well too. People also sometimes find benefit by removing high histamine foods. And to get an idea what high histamine foods are, just Google high histamine foods, and you'll see ones that you might want to try to avoid with mast cell activation, okay? All right, then the next step that you want to do is you want to take steps to stabilize your mast cells. And one of the most potent stabilizers of mast cells is quercetin. There's also another one called luteolin. And I believe the histoquel, we'll look at it together, I think has both luteolin and quercetin in it. But usually when you're working with your mast cell stabilizers, either with histoquel or quercetin or luteolin, it's going to take about a month or so for them to get those mast cells adequately stabilized, okay? All right. In addition to mast cell stabilizers, you want to be possibly on histamine blockers. And those can be things like a ketoprofen, or they could be things like Allegra, or they could be things like Benadryl. Okay, those are histamine blockers, all right? And then also you may want to be on something to deal with the inflammatory effects of histamines, which is a drug called Singulair, can sometimes be helpful as well too, okay? And so those are some steps. And then finally, one thing that can be helpful sometimes is to use something called low-dose naltrexone. So naltrexone is a narcotic blocker. It's used for people that have narcotic addictions, and it binds to narcotic sites, or what are known as endorphin receptors in our bodies. In addition to binding to those sites, it also binds to another group of receptors, which are called toll receptors. And it so happens that mast cells have toll receptors on them, and having naltrexone on board binding to those sites can turn down your mast cell activation as well too. The way you dose low-dose naltrexone is usually start at 1.5 milligrams a day, and every 2 weeks you increase until you work up to a total of 4.5 milligrams a day, okay? All right, so obviously there's a lot of stuff I just said here. I'm going to show you an article that you can look at that outlines this full approach too, okay? I like that you're treating yeast with this weed, seed, and feed approach. And everyone, what that means is if you get too many yeast in your intestines, weeding means killing them. And even after you kill them, using things to control them that are killers to kind of survey the environment to keep them from coming up. Seeding means putting good probiotics into your intestines to repopulate your intestines. And feeding can take on two things. Number one, it means don't feed them a lot of simple sugars like cookie, candy, cake, ice cream, all right? And in addition, foods that are rich in soluble fiber like avocados represent a good food source for your yeast as well too, okay? So I'm going to show you two articles you can take a look at. One will talk about weed, seed, and feed, and the other one's going to talk about how do you manage mast cell activation. So let me just do a quick screen share here. All right, so in terms of finding the article that I've written on how you manage mast cell activation, take a look at the immune system chapter here. And here's my article on mast cell activation syndrome. And down here, I even talk about the symptoms you can have. I talk about why testing is not always the best way. And then down here, I start talking about what to do to manage it. So decrease stress, remove what you're allergic to, treat infections, remove toxins, lower cytokines. I forgot to say that, but deal with the inflammation triggered by this. So curcumin can help with that. Block histamines, and that's what I was trying to tell you about earlier. And then stabilize mast cells. You can either use quercetin with luteolin, or you can do the Histoquel product that I was talking about as well too. And then try a low histamine diet. Okay. All right. And then in terms of, what was the second part here? I was going to show you another article. Hold on here a minute. Let me see here. Oh, weed, seed, and feed. Let's see. Let's take a look where I see where I put that one. Take a look at this article called How to Fix Recurring Yeast Treatment or Recurring Treatment-Resistant Intestinal Yeast Overgrowth. This is where I outline a weed, seed, and feed approach, okay? All right. All right. Thanks for that question, Jackie. Oh, I know. We're going to look at one other thing. What is in Histoquel? All right. So this is my supplement store, Marty Ross MD supplements. If you're ever looking for products I recommend that I have found helpful with my patients, and also companies that are using quality ingredients that have a track record of working, you could take a look at this site here. Anyone can purchase from me. Keep in mind, if you're making a decision to purchase from me, I cover your taxes. So you don't have to pay taxes. And I cover shipping if you have a total order of $50 or more. Okay. So in terms of the Histoquel, here is the Histoquel product. And then in terms of what's in it, actually, I'd probably do it better this way. So it's got a form of quercetin in it. They call it quercefit here. It does have the luteolin. It also has something called beryllium, fisetin, and black cumin and stinging nettle. Of the agents in here, it's going to be the quercetin and the luteolin that's going to give you the most benefit. Okay. All right. Thanks for our question, Jackie. Good luck to you. Hello, Debrusha. Let's see. Hi. Hello, Dr. Ross. Thank you for all you do for Lyme community. You're welcome. I live in Australia where help for Lyme disease is really limited. It's extremely limited, actually. I understand they recently of the medical boards there and the government have basically said primary care doctors cannot diagnose or treat. It's terrible. So I'm sorry to see what's happened in your country there. I want to ask your opinion on my symptoms and treatment. I have been suffering from cyclic flare-ups approximately every 5 to 8 days for over 5 years. My symptoms are severe head pressure, disorientation, cognitive impairment, hysteria, anger, muscle pain, traveling nerve pain, night sweats on the chest, pulmonary pain, sore soles of the feet, swollen submandibular glands. Symptoms last for 1 to 2 days, feel better outside, worse in full moon, mold, critical lepus, and exercise. I've been treated with 100 milligrams of doxy, 250 milligrams of azithromycin for 8 months, and liposomal biocidin. Some decrease to symptoms, feel better in good days, but flare-ups still the same. Longest time with no symptoms was 3 weeks. When stopping antibiotic symptoms return within 5 to 10 days. I stayed on low-dose antibiotics because of consistent issues with yeast. I'm puzzled by the frequency of the flare-ups. Oh, I think you said something else here too. So hold on just a minute. Let me see if I can find the second part to this. Lynn, I'm not seeing a second part to this, but I'll make some comments based on what you did say here. So when you have active Lyme or you have another type of infection like Bartonella, you can kind of look at how quickly symptoms return to gauge what is most likely which germs might be involved, okay? So the Lyme infection, the Lyme germ, has a very slow replication cycle. By some estimates, it replicates about every 4 to 8 weeks. And therefore, if you stop a treatment before its time, it usually is going to take more like about a month to 2 months before symptoms start worsening from stopping a treatment too soon. Okay. Bartonella, on the other hand, replicates every 24 hours. And it's very common that if you stop a treatment too soon, within weeks to even days, you may have a flare-up in symptoms. All right. So the fact that your symptoms flare so quickly after stopping the treatment says maybe there's some Bartonella here to me. Okay. All right. All right. The second thing I want to look at is your in terms of how long does it take to recover. So if you are on a Bartonella treatment that is effective and it's working, usually by about 4 weeks to 8 weeks into the treatment, your Bartonella symptoms will start resolving, and by 4 to 6 months, they'll be gone. So if you have Bartonella present here, the fact that symptoms came back so quickly would suggest to me that the combination of doxy and azithromycin you've been using, although that can be a Bartonella treatment, has not been effective enough, okay? All right. One other comment I want to note is that when you have a Lyme germ infection, it's not uncommon that it can take 1 to 2 years or longer to get rid of it. All right. So what this would suggest to me, just what you basically have said here, would suggest to me that maybe you still have ongoing Lyme, which can give you kind of the cycling of symptoms that you're having. And I wonder about Bartonella based on how quickly things decline. The other reasons I, though, worry about Bartonella in you is the significant cognitive impairment, disorientation, hysteria, traveling nerve pain. Those are things that sometimes we see with Bartonella, although there can be an overlap with Lyme symptoms as well, too. Okay. So I'm not clear if your existing treatment is working well enough for you. And yet I know the problem is in Australia, what other treatments are you going to get? Okay. You might want to take a look at my Lyme treatment protocol where I talked about herbal antibiotics you can use that would address both Lyme and Bartonella. And you might want to take a look at that as an option. You might also want to look at my articles on how to treat Bartonella and how to treat Lyme for additional prescription information. Okay. Now, one prescription option, if you could get somebody to do it that you could consider, that would cover both Lyme and cover Bartonella, is to use as part of your treatment the drug called fluconazole or diflucan. Now, I want to explain that, right? So that's a medicine traditionally we used to treat yeast, but it is a member of a family of antibiotics called the azoles, all right? And azoles as a family are able to treat the cyst form of Lyme. They're also able to treat growing and persisting Bartonella. All right, so you got a Bartonella treatment there too. All right, and then you might couple those with, let's see, you've been doing, instead of doing, it would be to couple them with Clarithromycin, which is in the same family as the azithromycin, and you can have an effective treatment for Lyme and Bartonella that is treating persister Bartonella and Lyme, but not persisters. That involves using Clarithromycin and fluconazole. So Clarithromycin for Lyme treats growing spirochete Lyme and intracellular Lyme. The fluconazole would pick up the cyst form of Lyme. So Clarithromycin would be growing spirochete, intracellular Lyme. Fluconazole would be cyst Lyme. And then for Bartonella, clarithromycin can help kill Bartonella, and fluconazole treats both growing and persister Bartonella. Okay. Then the other thing I would consider adding in is an herbal mixture that would treat for persisting Lyme. And one way to do that would be cinnamon, clove, oregano capsules, or cryptolepis is another way. Cryptolepis is an herb we traditionally use to treat babesia, but according to Hopkins research that came out last year, cryptolepis may also be effective against treating for growing and persister Lyme and Bartonella too. The dose you might look at doing is anywhere from about 2.5 to 5 milliliters 3 times a day, so really hefty dosing on that. The clarithromycin dosing would be 500 milligrams twice a day, and the fluconazole dosing would be 150 milligrams to 200 milligrams. Fluconazole is the same thing as diflucan. Okay, so these are ideas you might want to talk to your prescriber, whoever that is, because I know it's kind of hard to find prescribers these days in Australia, but those would be some things you might want to consider. Okay, all right. Good luck to you. Hello, Lannis. Yeah, Dr. Ross. An article appeared today on Medscape about several vaccines in development for Lyme disease from Moderna and one from Pfizer. And the article also referenced something called the Lyme X Prize for developing better testing. Do you have any thoughts or information about either of these developments? Also, there is going to be a free online summit on Lyme disease May 9 to 16, through Dr. Talks. And the participants include Sonia Schwieg, Darren Ingalls, Richard Horowitz, Burrascano, Neil Nathan, Jill Krista, and Beth O'Hara. I have no affiliation with this summit. Would you recommend it? Finally, would the practitioner group you're putting together be open to mental health practitioners? Okay. So, first of all, I am aware of that Lyme Summit, and I know the physicians you've mentioned here that are speaking, of those physicians, I think they're all good people. So there might be some information you might learn from them. I know there are additional speakers in the forum, some that I have questions about, but for the most part, I think, give it a try. You might pick up some things, okay? In terms of the Lyme vaccine, there are vaccines under development, and it is possible that one of these could be something useful. I have been following it. I know that one of the trials has been going on. I believe it was the Pfizer vaccine. They had some problems with they're already in doing research on people to try to see if it's going to be effective. And one of their research arms they were not following their protocol correctly, and they had to cancel all the data from that and start all over again. So they're delayed on it right now. And so it's hard to say what's going to happen with this new vaccine. I know that there was a vaccine that was out a number of years ago called the LymeRix. And when it came out, there were a number of people that started claiming side effects from the vaccine, and it was pulled from the market, mainly because the insurance didn't want to take the risk, or the pharmaceuticals did not want to take risks from it. In retrospect, it's not clear that the actual vaccine was causing any problems, that some of the symptoms people were talking about were more coincidental, but the pharmaceuticals did not want to take the risk. It's not clear to me yet whether these new vaccines, number one, are going to be safe. Will they trigger issues? And will they work? And so I still have to see the data that's going to come out about these when it comes out, much like I evaluated the COVID vaccine based upon data too. So I'm watching. It would be nice if we could find a vaccine that works, so we stop causing more chronic Lyme to develop. It's not going to help all those out there that already have it, though. But it would be great if that would be a possibility. I think it would be a really good thing. Okay. In terms of the Lyme X Prize for developing better testing, yeah, there's competitions going on. I'm not aware of what it's going to yield yet, but I am kind of watching from a distance on that one as well, too. All right. And then in terms of my groups that I'm putting together. So right now, many of you know, I am in the process of winding down my medical practice right now. In fact, I'm in Seattle, and this is the last week and a half of clinical care that I'm going to give people for Lyme. One of the reasons I'm doing that is that it's going to free up my time to find other ways to support people living with Lyme and practitioners. Okay. So as I stop practice, I'm still going to keep my online store going. I'm still going to keep these free webinars going. I'm still going to keep my Lyme disease information site going and update it. All right. So it's going to give me more time to focus on those. But there are two new communities that I'm looking to set up, and I'm going to go with one of these first. So I'm creating a new online community using a platform called Circle. So not on Facebook. You don't have to join Facebook to do it. But that new community is going to be called LymeUNITED. And it's going to be a group. It's going to be a community. The tagline is a community powering health. Okay. So LymeUNITED, a community powering health. And it's going to be for people living with the illness, not for practitioners. And in fact, I'll be screening to make sure that it's people living with the illness. All right. And what I'm envisioning at this point, I'm in the process of still designing it. I'm looking at a launch date somewhere between June and July. And so I'm going through the steps I need to get that ready to launch. All right. After I have that going, and I've worked with it long enough, and I've worked with my moderator long enough to know how that we're functioning well. Once I get that all going adequately, then probably about 6 months to a year later, I would like to also then follow through with getting a community set up for practitioners. And the purpose of that community is going to be to support practitioners learning how to treat Lyme, or even some of the seasoned ones that just want to have a forum that they can sit down and get some help trying to figure out what to do. Part of that forum, I'll be educating people on how to manage Lyme disease as well too. And for that one, I'd probably be open to any kind of practitioner, mental health, people that are mental health providers, as well as clinicians that are non-mental health providers. All right. So, but that one is going to be my second community. I'm not ready to, by any means, to get that one launched now, but that'll be something we'll be doing in the future. Okay. All right. Thanks for that question. Good luck to you, Lynn. Hello, Brianne. Let's see. Hello, Dr. Ross. Thank you for all of your knowledge and guidance. I'm struggling to treat Bartonella with any antimicrobials. I have extensive herxes. I have mold and detoxing heavily. I'm thinking about adding a peptide. What do you think is better, TA1 or BPC157, or thymosin alpha 1, I should say, and BPC157? I've tried both 2 years ago, but had MAST Cell Activation syndrome flares. They've calmed significantly, and thymosin alpha 1 injection gave me anxiety. Looking to retry oral method. Thoughts? Bear with me here a minute. Okay, so in terms of, just based on what you've said here, and again, I don't get to ask you a bunch of questions, okay, but so BPC157, everyone, is a peptide that is made in the stomach lining. And it has its purpose, the reason the stomach makes it, is to help with digestive function, repair injury to the digestive tract. It is available in a pill form, and it is kind of recognized as the Swiss Army knife of peptides, okay? So to clarify, peptides are made up of amino acids. And amino acids, as many of you know, also the building blocks of proteins. What makes a peptide different than a protein is the quantity of amino acids. So if you have 40 amino acids or less, we call that a peptide. And if it's over 40 amino acids, that's called a protein. All right. So BPC157 is interesting in that it might stabilize your mast cells to a degree. Although I think if you really want a strong mast cell stabilizer, I would go with the peptide called KPV. But BPC157 can do that. BPC157 can also repair muscle and tendon and nerve injury, so it can help with that. And BPC157 can modulate the balance between Th1 and what's known as Th2 inflammation, which would help modulate some of the anxiety that the inflammation that you're having as well, including those from the herxing as well. All right. Keep in mind, though, you're not going to get immediate effect from the BPC 157. It can take a good month to 2 months to help. The thymosin alpha 1 is no longer available here in the States for injection. And so I don't think it's available here anymore. So given that, I would probably go with the BPC 157. Okay. All right. And let me show you my article on peptides for those of you that wonder what we're talking about here. Oops, get out of there. This is my article on peptides, key oral peptide strategy to repair and restore in Lyme and mold toxicity. And in here, I review BPC 157, a peptide called cerebrolysin that can help with trauma to the brain and thinking function, basically. Thymosin beta 4 or TB4 frag, KPV, thymosin alpha 1, which is a peptide that I said is available by and had been available by injection, but the Food and Drug Administration got involved and said, no, you can't do that one anymore. But there is an oral product that mimics what this is supposed to do. All right. So anyhow, you can take a look down here where I review what products have similar effects. But given what's happening with you, what I would suggest probably is starting with the BPC 157. Okay. All right. Good luck to you. Hello, Doug. Hold on here a minute, everyone. Hold on just a minute. I'm sorry, guys. All right, let's see. Hello, Doug. Let's see. I have mold toxicity, Lyme, and Bartonella. I've tested positive for all of those and have been clinically diagnosed. My real-time test showed high levels of mycotoxins. I've been treating the mycotoxins with GI detox and was planning on starting antibiotics for Lyme and Bartonella soon. Here are my questions. On page 235 of your new book, you talk about the inability of about 25% of the population to excrete both mold and Lyme toxins. I'm likely in the 25% group. Do I likely need to continue to use it to excrete Lyme toxins? Also, my sinuses are clogged and my doctor believes I likely have colonization there too. How do I know whether I have colonization there or in the intestines? Would itraconazole spray work for the intestines? Would the pill form work for both sinuses and intestines? 2, when you treat Lyme and mold at the same time, do you keep both treatments going until symptoms recede? How do you know when to stop each one? And there is a third question. Let me go through the first 2 questions here. All right. So in terms of Lyme and mold toxicity, the toxins that are released by both Lyme and mold are similar and handled in a similar way. And so what happens in 25% of people, there's a genetic predisposition where when you breathe in a mold toxin or you develop Lyme toxins, what's supposed to happen is your immune system is supposed to tag those toxins, and then other white blood cells are supposed to come in and break the toxins down. But in 25% of people with a genetic programming problem, the tagging doesn't take place. And those toxins then go to the liver. The liver is supposed to be your next line of defense, and the liver is supposed to be able to add a chemical water-soluble group to the toxins, making them water-soluble. But the liver doesn't do that either. And so they leave the intestines still as a fat-soluble toxin. They go out into the intestines, and as something that's still fat-soluble, they get reabsorbed right back into the bloodstream, okay? So we want to have you take something that's going to bind up those toxins in the intestines, like a GI detox. So GI detox is made up of a number of ingredients that can grab hold of both mold toxins and even Lyme toxins, all right? So what I will usually wind up doing in terms of how I decide if I'm going to need to keep somebody on a GI detox for possibility of Lyme toxins is I will wind up, for the mold toxin part of things, is after I've had somebody on a mold toxin treatment for about 4 to 6 months, I'm going to go back and repeat my urine mold toxin level testing, all right? If those levels are decreasing and they're decreasing, then I know that I'm being effective with my GI detox at pulling toxins out, and I'm going to keep using the GI detox longer, basically, usually until I get a person's toxins out completely, and I repeat their mold toxin test about every 4 to 6 months, and if the toxins are gone, then I decide to stop it, okay? Now, when I stop the binder, when somebody has normal mold toxin levels, I stop the binder. If they worsen pretty quickly, then I want to go back on the binder because I think that that's then helping with mold toxins. I'm sorry, Lyme toxins at that point, okay? So the way to determine if I still need to go for Lyme toxins, because we don't have a test to measure them, is if I get mold toxins out and somebody declines once I stop the binder, I assume that means that binder was probably helping remove mold toxins. I'm sorry, Lyme toxins, Lyme toxins. And so I want to add it back in again. Okay, now, when we repeat the mold toxin study in terms of trying to decide if you need to treat for a colonization of mold in your nose or your intestines, you have to look at what's happening with your mold toxin studies, all right? So if you use binders for about 4 to 6 months and you go back in and you retest your mold toxins and the levels are increased, and if you're not doing any better, then that may mean that you're still being exposed either from your environment, it could be you still have environment exposure of mold toxins, or it could mean that you are producing your own mold toxins yourself, all right? So whenever you are exposed to mold in your environment, there is a possibility that you can become colonized with small numbers of spores that line your nose passages and get into your intestines. And those mold spores become their own toxin brew pub, if you will, and can produce their own toxins. The trouble is we don't have a good test. There's not a good nasal swab test. There's not a good test for the intestines to figure out if you have spores in there, microscopic amounts of spores that are colonized producing this. And you can't, my experience is you can't use nasal congestions as a means of determining if you have mold up in your sinuses that's causing the problems as well too, all right? So the symptom of nasal congestion does not necessarily mean you've got mold spore colonization. It could be allergies. It could be a bacterial sinus infection. It could be a number of things, but it doesn't necessarily mean that you've got mold spores up there. All right. So how I determine if I'm going to add in a treatment for possible mold colonization is if I've treated with binders and we're 6 months into treatment and the numbers are not getting better, then I'm going to have somebody go back and re-investigate their home, get another mold inspection of the home. If that comes back clean, then I have to wonder, do you have mold colonization, spore colonization of your sinuses or your intestines that's producing toxins that are adding to your problem? All right. And if you do, then I'm usually going to wind up putting somebody on itraconazole, a 100 milligram pill, 2 pills 1 time a day to treat for the intestinal colonization. And some of that medicine will get in the bloodstream and go up to the sinuses and start to treat sinus colonization. But in addition, I'm usually going to want to put somebody also on either a colloidal silver nose spray or a nystatin nose spray or an itraconazole nose spray or even an amphotericin B nose spray to start treating for colonization up there as well too. Okay, it's a really complicated problem when you get mold toxicity. If things aren't responding to just being on binders alone, then it gets expensive because you got to go back and look at your home environment, and you may need to start treating for colonization as well too. Okay, all right. Good luck to you, Doug. I'll see if I can find the second part to your question here in just a minute. It does not look like I'm able to see it there, Doug. Thanks for the question, though. So everyone, in terms of if you're looking for more information on mold toxicity and the approach that I was just talking about, you could take a look at my Lyme education site, take a look at the detoxification section here, and then read this mold and Lyme toxin illness article, which is the same information that is included in my Lyme book, Hacking Lyme Disease, that Doug was talking about in this question. Okay, and if you want more information about my Lyme book, take a look here under my books. And my book is called Hacking Lyme Disease: An Action Guide to Wellness. It is a compilation of nearly 40 articles, key articles from this site, and includes a whole host of information you can read about here. And you can either get it from my store or you can get it through Amazon as well too. Okay, all right. Hello, Jacqueline. Let's see. I haven't hit you up since the beginning of the pandemic. Jackie from New Jersey, using full name. Another Jackie is here. Hope Thor and Halo are great. So Thor and Halo, everyone, are my two Basinjis, and yeah, they are. They're actually sleeping away. I think Thor was up back there earlier, but no, they're under my desk here sleeping. They're getting old. Thor's now 14 and a half. Halo is 15 and a half, and they're really slowed down. So, but yeah, nope, they still make the rounds with me here. Let's see here. So Lyme, Bart, and Babesia, 29 years, 2017 Grand Mal from Doxy Herx, was told 83 seizures within 48 hours, then too many, not possibly epilepsy. A bit into the pandemic, unbearable severe trauma around me. I didn't know I was having seizure-causing psychiatric and other symptoms. My mental state very severely deteriorated. Found an amazing neurologist with a degree in pharmacology. 3 to 4 seizures an hour. More with pain and stress. Partial complex, left temporal lobe. They relocate right mirror image or left frontal. Chikondi XR 200 milligrams showed improvement on the ECG, and 300 milligrams seizures worsened. While waiting 5 weeks to test Aption on EEG, I contracted COVID. Concussion on the left where my seizures present. Also, I'm tick magnetic, mostly off. Let's see, Jacqueline, I think there's a second part here. "28 ticks in 2020 untreated. 3 months ago, 15 ticks after 10 minutes on my lawn untreated. I do have at least 42 100 milligrams of doxy take. I think you're asking me if you should take that doxy. My doctor had confidence Aption would help my type of epilepsy. My symptoms worsened even after COVID was no longer a factor. I have weaned off 200 milligrams of lamotidine antidepressant seizure med, as I'm curious how my naked brain functions. Reducing this worsens the seizures, lodidrine, Neurontin, clonazepam, sometimes medical marijuana, the only relief thus far. Diagnosed in 2014, procrastinated as I barely function and need to accomplish much prior to lengthy hercs. Then family responsibilities. Now I assume seizures must be under control prior to herxing. Am I wrong? 3 years ago, I herxed with 103-degree fever from glutathione, I presume. Can seizure meds cause a herx? Lyme since 15, desperate to get a life with meaning and wildlife sanctuary. Look healthy and great, Dr. Marty. All right, let me see here. All right, so Jacqueline, you've got a lot going on, and I'm going to make some comments. I don't know if I'm going to entirely be able to answer your question because there's so much going on. I need to ask you a bunch more questions to come up with a recommendation for you, but I'm going to make some observations for you, okay? So when people have severe neurologic syndromes and they have a history of tick bites, you've got to wonder about Bartonella as well as Lyme being both there. Bartonella can give you the severe seizures. Bartonella can give you a lot of the anger and rage, I think, that you mentioned here. Bartonella can give you a lot of neurologic effects as well, too. So what I do with my patients, I may have a neurologist see them to help manage the seizures with medications, but part of your treatment is also killing the germs and getting rid of the thing that's agitating your nervous system, if that's Lyme or if that's Bartonella. So I hope that you're working with a doctor that understands Lyme disease, because I think you need a Lyme literate medical doctor given the complexity of what's happening here. And they should be helping you look at how do you treat Lyme and Bartonella. And that's what I'm going to steer you towards. Unfortunately, this is not one that you're going to easily manage on your own, or even with me just giving you recommendations here. But I would wonder about Lyme. I would wonder about Bartonella. And I would wonder if you've been adequately treated at all for either one of those. Okay? All right. And in this situation, using usually 21 day or 20 days of doxy is what I recommend for an acute tick bite. That is not going to be enough to take care of if you have chronic Lyme or chronic Bartonella that's giving you problems. Okay. All right. So I'm going to see, and I know you may be thinking, I can't get a doctor. Well, I can't give you help in this type of a forum with that much information and that complexity of a problem. You need to get a Lyme literate doctor who can give you some help. All right. Good luck to you. Hello, Frank. Dr. Ross, around the time I started giving my wife Cytoquil, I noticed she was complaining of an increase in insomnia. I see that it contains black tea extract. Have you seen this in your patients? Also, any update on the availability of the TB4 product? It's been out of stock for quite a while. Thanks. So, no, I don't have an update from Integrative Peptides around the availability of their TB4 product, and I am upset at how they regulate and manage their supply chain. I think they make a good product, but I have really been unhappy with them as a supplier and the way that they've been managing the production of their various lines. So I don't have an estimate. What I will tell you is that the TB4 frag is also available in a spray form, and you may want to take a look at that. That is available at this point. The pill form is not available at this point, though, okay? And you can look at how to use it and the product page at treatlyme.com where you can take a look at that one, okay? In terms of the black tea extract, the black tea extract does not contain caffeine. So that is not what would be giving the issues here with sleep. But keep in mind, there are common side effects we see with any herb or prescription. And then there are the side effects that happen in you, all right? And there is a rule of thumb I have, which is anything can happen to anyone with anything. And what that means is if it is possible that something in the cytoquel is causing insomnia, in which case you may want to think about stopping that. The cytoquel, as you know, is designed to lower cytokines. And I think the most active ingredient in the cytoquel that's decreasing cytokines is the curcumin component, okay? And what I prefer to use actually in my practice is a product made by Thorne called curcumin phytosome. And the way I dose that to lower cytokines is as a 500 milligram pill, one pill 3 times a day. And that might be something for you to consider because I have never seen it to give insomnia actually, okay? For those of you that are not familiar with what cytokines are inflammatory chemicals made by your white blood cells whenever they see mold toxins, yeast, or bacteria infections in you. And they're good in the sense they're designed to turn the immune system on. But often they don't do a good job of turning the immune system on. And because of that, then the immune system, they turn the immune system on, and because the immune system isn't doing a good job, it keeps trying harder and harder. And eventually the immune system makes too many cytokines, okay? And the problem with too many cytokines is they can give you too many cytokines then lead to a lot of what we call Lyme symptoms. So too many cytokines make it so you can't think. They can give you a lot of your body pains. They can interfere with how your hormonal systems function. They can give you a lot of your joint pains, muscle pains. They can lead to psychiatric issues, and they can even lead to some of the poor sleep patterns that we see people have with this illness. So a key part of treating Lyme is lowering cytokines. So if you can't do it with the cytoquel, then I would consider looking at a curcumin phytosome by Thorne. It's a 500 milligram pill, and I have my patients take it as 1 pill 3 times a day. Okay? All right. Good luck to you, Frank. Actually, I'm going to do a quick screen share here because I just want to show you a few resources. So in terms of cytokines and ways that you can manage them, what they are, take a look at this article here called Control Cytokines, and where I talk about the good and bad of what cytokines are, and I walk through a number of ways that you can work towards lowering them. And one of those is that curcumin that I was talking about right here, okay? Glutathione, something else that can help. Sometimes quercetin can help too, but take a look at this article for more information. In terms of the product I was recommending, if you were to take a look at my Herxheimer die-off reaction section here at the store, this product called curcumin phytosome by Thorne is the product that I was recommending for you, okay? Good luck to you. Hello, Erica. Let's see. My 11-year-old who has Lyme, Bartonella, Babesia, and Mycoplasma has recently added Lumbrokinase to her very aggressive IV antibiotics protocol after significant improvement over the past 1.5 years of treatment. We are starting very low and slow after attempting to introduce it last summer, and she had a debilitating herx. My question is, can Lumbrokinase be taken with other medications? I ask because she only takes capsules at night before bedtime because they hurt her stomach otherwise. Is it okay to take allergy research Lumbrokinase with other medications like rifabutin, methylene blue, low-dose naltrexone, and ketoprofen, or will make these other medications less effective? In an ideal world, of course, she would take it away from food and other medications, but with a chronically ill 11-year-old who does hours of infusions, 20 plus pills. Sometimes I have to work with the parameters of her cooperation, but I don't want to do anything to make her other meds less effective, and I would love your opinion. So the problem with Lumbrokinase, so Lumbrokinase, everyone, is an enzyme, a set of enzymes that's made by earthworms, right in the skin of earthworms. And we use it for a couple reasons in tick-borne illnesses. Number one, it can help break down biofilms. So biofilms are slime layers that cover germs. The second thing you can do, it can break down what are known as fibrin nest, which fibrin is a blood clotting protein that is found in your blood. And it sometimes can wrap itself up in and around your Bartonella and Babesia and cause them to get stuck to your blood vessel linings. And it gets hard to get antibiotics in your immune system in there to take care of them. So Lumbrokinase can help break down the fibrin and free up those germs to be swatted down by your immune system and by your antibiotics. As an enzyme, if it has anything else in the stomach with it, it's going to try to break that other thing down, which could make that other thing less effective, meaning medications. And it also would render less of the Lumbrokinase available to then break down your biofilms or break down your fibrin nest, all right? So I don't know that it will have any effectiveness, or it could even hurt existing effectiveness if you take it with anything at the same time. And I said anything. So I know you're trying to find a way to compromise, which I wish you could, but I'm afraid you're going to lose effectiveness of both the Lumbrokinase, and you may be making the medications, if you were to take with medications or supplements at the same time, less effective as well too. All right. So sorry about that. I don't have a good response for you there. All right. All right. Good luck to you. Hello, Dave. Dr. Ross, can you tell me what is the cause of my lower abdominal muscle cramps and the intercostal muscle cramps that occur in my chest area towards the end of the day and evening? They don't last long and they feel like a knife jabbing me. What can I do to help them? Also, occasionally I will have, toward the end of the day, severe burning in my eyes, and it burns like soap within them, burning severe enough that I may have to stop if I'm driving. Question 2, thanks for the info about peripheral neuropathy. Would taking BPC 157 to the glutathione and ATP 360 help? Thanks, Dave. Okay. So let me go through your second question here. So BPC 157, as I mentioned earlier tonight, is the Swiss Army knife of peptides. In addition to helping with some mast cell stabilization and doing tissue, muscle, tendon, and nerve repair, and also helping balance out inflammation from Th1 and Th2, it can also help improve mitochondria function. So mitochondria are the energy factories found in every one of our cells. And they can get injured due to the increased oxidizing agents that are made by your immune system in trying to get rid of infections. If the covering of the mitochondria gets injured from these oxidizing agents, then you have poor energy generation in your cells, and it can be a contributing factor to fatigue and even cell dysfunction, okay? So what rebuilds the covering is that ATP 360. It has a number, it's made up of a lot of the fats that make up the covering of the mitochondria and a number of micronutrients. And as a part of repairing mitochondria, when somebody has fatigue that's really not lifting well after about 6 to 9 months, I start thinking about trying to repair the mitochondria. And what I usually like to do is start ATP 360, 3 pills 1 time a day, and glutathione as the research nutritionals product called Trifortify. And I have people take a teaspoon a day of that too. The glutathione works by lowering oxidizing agents in your mitochondria, which can help repair the mitochondria from the inside. The ATP 360 is helping from the outside. Okay. Now, I will use those alone. I usually don't add BPC 157 in to help with mitochondrial repair. I may consider adding it in at 2 months if we're not starting to get good improvements in energy. That's the point I would add it. And I would consider adding it as 1 pill twice a day at that point, okay? Now, if you have other reasons to use the BPC 157, like you've got bad neuropathy, you've got severe joint dysfunction, joint pains, then you might want to add it sooner, all right? But yeah, I would add it, but usually I would wait and see if you're getting adequate help out of ATP 360 or glutathione first, okay? All right. In terms of the dry eyes, boy, I would almost need to take a look in your eyes when they're burning to see if there's any signs of inflammation. Sometimes also I would just let you know, sometimes dry eyes give you burning. So why it's happening that time of day, I don't know. This is something I probably would talk to your primary care doctor who can look at your eyes. I don't have the benefit of being able to do that here. And I don't have a quick answer for you on that one. In terms of your other pains, I don't have a quick answer there because I would want to examine you. but I will make a comment in that usually nerve pain, neuropathy pain, usually has the qualities of sharp stabbing, burning, piercing, or electric. So I would have to wonder about some neuropathy pains. And what can help with that is ATP360 and glutathione. By repairing your mitochondria, you can help repair your injured nerves. And yes, BPC 157 can help with that as well too. Okay? All right. Good luck to you, Dave. Hi, Nancy. What is currently the best testing for Lyme? What about the IGeneX culture plus PCR? What does the research show? All right. So the best test for Lyme, in my opinion, remains the test by IGeneX called the Immunoblot, not their new PCR based culture or their culture plus PCR. All right. So let me talk about that and why I'm saying that. So, and they have not published what their sensitivity is yet. So sensitivity means what is the ability of a test to detect if something is there, okay? Regarding their Immunoblot method, which is a technique we use to see, does the immune system have antibodies that attach to proteins found in the covering of the Lyme germ? That method also looks to see if you have antibodies against 8 strains of Lyme germs, okay? And it's measuring an immune reaction. The sensitivity on that technique based on IGeneX validation studies is about 95%. So it can find Lyme if it's there about 95% of the time. And its specificity, meaning if it says it's positive, it really is positive, is about 100%. Okay. The problem with any culture is you've got to have, the germ has got to be swimming by the needle when you put it into a body and draw the blood. And Lyme does not easily live in the bloodstream. The blood is full of oxygen. Lyme likes to live outside the tissues. And so there is not a way of accurately knowing what the sensitivity is of the culture. And so there's a good chance that it may be missing a lot of Lyme, even if it's there. Now, if you're looking for confirmation, if the culture comes back positive, yeah, you for sure have the germ in you. But the problem is we don't really know for sure how sensitive it is. Okay? All right. Thanks for that question, Nancy. Hello, John. Hello, Dr. Ross. I've been battling Lyme and Bartonella for over 10 years now. Have been through many rounds of oral and intravenous antibiotics, a full year of the Cowden protocol, and various alternative treatments. I think the Lyme is under control, but still working on Bartonella symptoms, foot, sole pain, neuropathy, bone pain, etc. Following your support recommendations, my sleep is relatively under control with L-theanine and Ambien. Also taking Mariva, ashwagandha, and vitamins. I can't tolerate Biaxin, cloves, or cinnamon, so I've been trying your tier 2 approach with Hutania, Sida Akuta, and Japanese knotweed tinctures for the past 30 days, but not seeing any improvement yet. Maybe slightly worse, but hard to tell. What did you see as the typical course of improvement with your patients on this protocol if it was working? Would you consider adding Lumbrokinase at this point or waiting another month as in your guide? So typically, if for any Bartonella treatment, whether it's prescriptions or herbs, herbal antibiotics, if they're working, it can take up to 2 months to start seeing results. With the herbs, sometimes up to 3 months. So I think you need to give it a bit more time here still. And if you have not gotten a severe herx by using the herbs, you could proceed with adding Lumbrokinase in at this time. All right, so everyone, the reason to add Lumbrokinase in, again, is it helps break down these Bartonella fibrin nest. Keep in mind, as you start breaking down the Bartonella fibrin nest, and if you're on antibiotics, those germs are going to suddenly be exposed to those antibiotics, and I mean herbal or prescription antibiotics, and so you can get stronger herxes. But if you're stable and you're not herxing, you could give it a try at this point too. I usually have people start at 1 pill a day, at 16 milligrams or 20 milligrams, 1 pill a day. And if you don't herx after about 7 to 14 days, then you might try to increase it to 1 pill 2 times a day. Okay? All right. Good luck to you, John. Hello, Ellen. Has Cryptolepis replaced cat's claw and atoba bark as your preferred Lyme and Bartonella herbals? Your book recommends cat's claw and atoba, but your website as of February 2023 recommends Cryptolepis. Also, should herbal tinctures be taken in 4 ounces of water? Thank you. So in terms of taking your herbal tinctures, you can drop them right in your mouth if you want to, or you can mix them together in some amount of water. There's not an exactly right amount, okay? And then in terms of, no, at this point, my preferred treatment still is, for Lyme, would be Atoba cat's claw with the cinnamon clove oregano. And for Bartonella would be Hutania sida acuta and the cinnamon clove oregano. That's where I start. That's what my protocol says, okay? What I have laid out is there are other things you can do if those treatments aren't working, of which Cryptolepis can treat growing and persister Lyme and Bartonella and would be a part of a treatment, but would not be the exclusive treatment. Okay. All right. So anyhow, I hope that gives you some information there. Good luck to you. Hello, Bill. Let's see. Hi, Marty. If you stop low-dose naltrexone and restart 2 weeks later, should you go back to 1.5 milligrams a week, then 3 for a week, then back to 4.5, or can you restart right at 4.5? You know, in my practice, I usually just go right back to the 4.5. If people pause their low-dose naltrexone for anywhere up to a month or 2 months, I sometimes will just have them resume back to the dose, especially if they did not have side effects as they were ramping up the dose the first time. So on 1.5 or 3 milligrams, and then eventually 4.5 milligrams, if there were no side effects, they tolerated it well, then I have them just jump right back to the 4.5 milligrams when they resume again. Okay? All right. Good luck to you, Bill. All right, for those of, so there's been a couple low-dose naltrexone questions tonight, so let me just show you guys a resource here. Let's see, it's probably going to be under my immune system here. Yeah, here it is. Okay, this is my low-dose naltrexone article. And the reasons to consider low-dose naltrexone is that it can improve nerve and muscle inflammation pain. It can decrease autoimmune illness triggered by Lyme, can improve mast cell activation, can lower cytokine inflammation, and may improve the amount of a type of cell called Tregs that can create better balance between what is known as Th1 and Th2 inflammation. Okay, so those are all the things it can do. Take a look here at this article where I walk through why you might want to consider using it and how you would wind up using it too. Okay. Hello, Margaret Lee. See, my daughter has been on multiple antibiotics for over a year to treat 3Bs. I assume you mean Bartonella, Babesia, and Borrelia, which is Lyme. Recent Great Plains oat test showed severe candida and overgrowth of Clostridia non-difficile variety. She had very elevated oxalates. Do you think this is caused by the yeast? And if treated, will it go down on its own? She is being treated with oral amphotericin B, low oxalate diet. Is hard to do on top of gluten, dairy-free, low sugar. And 2, do you treat for Clostridia dysbiosis? They say she has high dopamine related to this. Can it exacerbate mental illness and other symptoms? Just a lot to take in. Thank you for all that you do. It's much appreciated. Okay, so Obviously, these are things you should be talking about with her prescribing physician, the one that ordered that test. Okay. And so regardless of what I say, these are things you should be talking with your physician about. Okay. So I no longer do oat testing to try to figure out if yeast is present. I do not find it to be reliable, frankly. So I would probably disagree with your physician who did this. I was doing them at one time, but when I go back and study the science about organic acids and whether they truly indicate the presence of yeast or not, there's a bunch of flaws to the method and flaws to the predictability. And in my own clinical practice, I did not find them useful. All right. So I usually rely more to determine if somebody has yeast based on symptoms. And so do they have a lot of gassiness and bloating? Do they have sugar cravings? In females, are they getting vaginal yeast infections? Does a person have a lot of skin changes, of eczema or worsened rashes or pimples and acne? There's toxins released by yeast that can cause skin manifestations of pimples or make pimples and acne worse, or make eczema or skin rashes worse. Okay, so I look at those things as determining, but I'm not that impressed with using oat testing or the reliability and predictability. Now, your clinician may have a different opinion on that, but that's my opinion. Okay, in terms of Clostridia, the main Clostridia to treat is Clostridia difficile, which I know you've indicated you don't have. The reason to treat Clostridia difficile is if it's grown in excess, it can release toxins that give you bad diarrhea, basically. I will admit, if this test is picking up non-Clostridia difficile, and if that it really is there, and again, I'm not clear about the predictability of this testing, okay? But if it is there, the treatment to create better balance in your intestines would be probiotics. Use a good mix of probiotics that's going to create better balance. That's usually how I wind up doing it, okay? Anyhow, those are just my thoughts. The oxalates, again, the way I treat high oxalates, if they are there, is I will do it through diet changes. As to whether it actually makes a difference, I've done low oxalate diets with a lot of patients and not found it to make any difference in how they felt, even though we got oxalate levels low. All right. So I'm not clear about whether that makes a benefit. And again, these are issues you should talk with her physician about too. Okay. All right. Thanks for your question, Morgan Lee. Hello, Karen. Let's see, Dr. Ross, any tips to reduce cytokine inflammation from Lyme, co-infections, MAST Cell Activation, COVID, antihistamines, NSAIDs, and low-dose naltrexone have not helped enough? Okay. So that's why I showed you that article earlier tonight about cytokines, but the main things I would start would be to use, the two lead things I like using would be curcumin, 500 to 1,000 milligrams 3 times a day. The product I like for that is the Thorne curcumin phytosome, because it's a liposomal variety of curcumin that can get good absorption. Okay. Second thing I like to do when I've got people having a lot of problems with cytokine excess is to get on glutathione. And the glutathione is useful for a couple of reasons. Number one, it is a very strong antioxidant that lowers oxidizing agents that trigger excess cytokines to be made. So it decreases the messenger that's telling white blood cells to make excess cytokines, okay? The second thing that it does is sometimes when you are ill with these illnesses, you have a lot of toxins in you, and those toxins also trigger excess cytokines. And the glutathione is the lead antioxidant, the lead detox agent used by the liver to clean toxins out. So you get some increased detox by being on it as well too. Problem with glutathione is making sure that you're taking a product that actually gets absorbed. Glutathione is easily broken down in the stomach. And so the product I like for that is a product made by research nutritionals called Trifortify. Trifortify is a liposomal variety of glutathione, which increases absorption. And research nutritionals has done some good research showing that when people are on glutathione, They looked at red blood cell levels and saw what happened, and there's marked increase in glutathione levels within red blood cells, showing that it does actually get absorbed out of the stomach and taken up into the bloodstream and therefore circulated throughout your body. Okay, so that's a product that can work. And I usually will dose that at 1 teaspoon a day. Again, that's Tri-Fortify by Research Nutritionals. Okay. So anyhow, if you're looking for sources of those, you can find both of those at my supplement store as well too. Okay. All right. Good luck to you, Karen. Hello, Jill. Let's see, is Lyme disease an autoimmune disease or only a subset? What about co-infections such as Bartonella and babesiosis? All right. So Lyme and Bartonella and Babesia can trigger autoimmune illness. So for some people, when they have continuous symptoms of Lyme and Bartonella and Babesia, some of their illness may be related to an autoimmune illness that gets triggered by having these infections, okay? And what may happen is there's a phenomenon where parts of the bacteria get recognized as being, and you have an immune reaction to those parts of those bacteria. Some of those parts may look similar to parts of us. And our immune system not only attacks those germs and the parts that it sees, but it may attack us and parts of us, our cells, our genetic material, et cetera, that have similar looking parts, basically. All right. And so that's what results in autoimmune diseases. Generally, what I'll try to do, if I've got somebody that I've been treating for like a good year or so, maybe we're not making any significant headway, then I start wondering, could there be some autoimmune component? There's not good testing that proves Lyme or Bartonella or Babesia induced autoimmune component, but one of the things that can regulate that quite well is actually low-dose naltrexone. So sometimes I'll try people on a trial of low-dose naltrexone. The low-dose naltrexone that I showed you the article on earlier tonight, if you're going to give it a try, you want to give it at least 6 months to see if it's going to make a difference. Okay? All right. Good luck to you, Joe. Hello, Frank. Let's see, Dr. Ross, thank you for all you do for Lyme sufferers. You're welcome. I have Addison's disease. Is there a different protocol for fighting my Bartonella? No, I don't think that having Addison's changes that. I mean, obviously, you need to be working with your primary care or your endocrinologist to manage the Addison's. But in terms of germ killers and everything else you would do, I wouldn't change that at all. Okay? All right. Good luck to you, Frank. Hello, Ricky. Hi, Dr. Ross. Thank you for taking my question. Do you know of a tovacone causing sweating in the morning and early afternoon, or could that be the Babesia as well? I'm sweating in the morning, but not at night, and being treated for Babesia. Also, how do you test for MAST Cell Activation syndrome? Do you use the MMP9 test? Thanks again. Let me just make a comment, and we're out of time here. So earlier tonight, I showed you an article on MAST Cell Activation syndrome. I'll show you. I'll read through my sections that I have there about how you test. What I will let you know is that there's no accurate testing. You have to make a decision as to whether you have MAST cell activation based on symptomatology. Okay, so I'll show you that article and focus on symptoms, and you can see ways that you could test for it, but they're not uniformly effective. All right. In terms of sweating, so sweating can be part of cytokine excess from having Lyme. Sweating, night sweats in particular, can be part of Babesia. And day sweating sometimes can be a symptom of Bartonella. So you can't use sweating alone as a clue as to whether you have these other infections. You could look at testing, and if your testing says Babesia or your testing says Bartonella, then they may be part of the problem. But you can also look at the symptoms that you find with Bartonella and the symptoms you find with Babesia, and if you have enough of them, then it could be either one of those leading to the sweating as well too. Okay, so Let me show you a number of articles that you can take a look at. Again, I apologize to do it this way, but we're out of time here. So let me show you where you can get the information. All right. So in terms of figuring out if you have Bartonella or Babesia, take a look at this how to diagnose section, and then read through this article about Bartonella and read through the one here about how to diagnose Babesia, right? List out the symptoms that can suggest whether you have those infections, okay? All right. And then in terms of the mast cell activation, take a look in my immune system section here. And here is the article on mast cell activation syndrome. And I did show this to you earlier, but it walks through here the type of testing that you could do. And I even make the point, testing is poor. Okay, but take a look there. All right. All right, everyone. Thanks for being here with me tonight. I enjoyed visiting with you. I hope you found some useful information. I'm sorry, as usual, there's too many questions for me to be able to get at here. Keep an eye out for your email tomorrow morning, somewhere between 9 and 9:30 a.m. You'll get an email from me announcing that the webinar video is ready to be seen, and I usually have a synopsis with that. So take a look at that. When you get that email, you can use it, also the links in it, to sign up for next week's webinar, and you can share it with people who you think might get benefit as well too. All right. So good night, everyone. I hope you all have a good week, and we'll see you next week.